Super. Good morning. We have John Gloster here with us. Hi, John. Good morning.
Good morning, guys. How are we all?
Very well, and thank you so much, John. I just can't imagine how you managed to squeeze this in this morning, but I am extremely grateful, and so is the entire fraternity who's gathered here today to hear from you. We will
Always a
not
pleasure.
keep you very long because we know the busy tight schedule you've got. But it is such good luck for us that we've got you here to hear about not just the learnings that you have to give us related to sports physiotherapy, but in general, the role that you've played over the last 2 decades in the industry and more. And you're not allowed to stop. I hope you know that. There's no retirement for John Gloster. But what we would
Yeah.
like to know really, and the fraternity that's gathered here today for the conference really, from you is, what it is really to be a sports physio, whether it is on field, whether it is in camp, whether it's in the dressing room, and whether it is even when you're off. I don't think you get days off because you're pretty much on call 24/7, 365, I'm pretty sure. But I guess,
100%.
when the heat is on, when the pressure is on, um, you know, what is life like for John Gloster as a sports physio? The stage is yours, John.
Look, thanks very much, and thanks everybody for being here. It's wonderful for me to be here, albeit virtually. It's almost like we're back to COVID times with this, but I'm sorry about that, given that I'm away traveling. But I was always keen to ensure that I got an opportunity to at least say something to you all and about my experiences over the last 20 years in the Indian sort of sports context or the sports world, and my last 30 plus years. And that makes me sound old, I know. My last 30 odd years as a sports physio, 26 of which have been predominantly with international cricket, but also mixed in amongst a number of other things, Olympics and various other wonderful sporting opportunities that I've had. So I'm going to dive in, and I'm just going to keep talking. I think I'll probably come up with a few things. I've got a few notes that I'd like to come back to, but as Kruti mentioned, and I think all of you appreciate that we've probably got one of the best jobs in the world, being sports physios, being sports physicians, being involved in elite sport. And we all get to combine our love of sport and travel and medicine and put it all together in a nice little package and hopefully help athletes and sports people to be the best they can. And that's predominantly what we're here for. So I want to give you a little insight into some of my learnings from the modern dressing room, from the context of us as the sports science sort of fraternity or the sports medicine physio fraternity. And within that, I incorporate everybody from the sports physios, the nutritionists, F&C particularly. A number of you will be in amongst this audience, physicians. We all have a role to play. But as you know, it now comes with so much more responsibility, given how sport has sort of changed over the last decade or two. The great Earl Warren, who was a Sports Illustrated writer back in '68, said that man's achievements are always on the back pages and man's failures are always on the front pages of the newspaper. And I'm certainly one of those people that reads the back pages first. I always dive to the sports pages. And so what we need to think about is how can you and I as sports physios and allied health professionals continue to bring Indian sport and ensure that those sort of back page stories display more of India's sport successes rather than the failures. And again, that's probably what we're all here and why we're all collected in order to help those outcomes. As I said, It's been sort of nearly 32 years for me in this business, and it's been extremely rewarding, particularly my last 20 plus years in the subcontinent. And that's where my greatest learnings have probably taken place, is my exposure to not just Indian cricket and the Indian cricket fraternity, but also the greater sporting fraternity here in India and the subcontinent. And for us, things are changing. I mean, they're changing rapidly in the sports medicine world, the sports physio world. It's an evolving profession. So we all have to evolve with it. And it's really interesting that we've moved, well, I certainly as a clinician, I think most of us will have, is we've moved away from the use of machines and technology in our general practice. I mean, we all, back in the good old days, you go into a physio room and there'd be a shortwave machine, there'd be a MF machine, there'd be an IFT, there'd be, whereas we've now moved away from technology and machines to more hands-on and exercise prescription-based interventions, which I think is wonderful. And I think that's the way that we should all be trained as well as thinking and practicing. But interestingly, we've actually embraced technology more now in our development of skills related to our profession in other ways. So technology has given me that window into an athlete's life, into their physiology, into their well-being. And it's providing me and us, and hopefully all of us, this enormous insight. And it's on the back of this insight that gives us the ability to make impactful, positive changes. And therefore, allowing me to have a greater chance of success at the agendas that I want to achieve, or we all want to achieve: improve performances, reduced injuries, and overall increased longevity for our sports men and women across the country. And we all do this, or we should all be doing this, by breaking down the barriers of our profession. And I think there's been too many barriers and constraints within our profession that perhaps, and I'm speaking more specifically sports physio here, that hasn't allowed us to think outside the box. We cannot continue to be constrained by the legacy of the past of our profession. And I always say that all barriers are there. They're meant to be broken, whether they be professional barriers, sporting barriers, mental barriers, whatever it may be. And many of you may have heard me talk about, one of the greatest stories of breaking barriers of all is the Roger Bannister story. Roger Bannister, the great English runner who was the first person to break the 4-minute mile back in 1954. And people had been seriously attempting to break the 4-minute mile in running since the 1880s. And it was interesting that once it was broken by Roger Bannister, within the next month, it was broken 3 times again. The great Peter Landy, the Olympic medalist from Australia, broke it within the next month. And then in a race just after that, 3 people in the same race again broke that 4-minute mile that they'd been trying to break for the previous 60 years. So why did that happen? It was all about the barrier. And once the barrier has been removed, then for the first time, the possibility is then seen beyond that barrier. So Roger Bannister, in his own way, had taught us about these psychological barriers, particularly in sport and in our profession, being a limiting factor. And we can translate that to any of our environments that we work in. And so this breaking of new ground, and we all need to think about our professions as how do we break new ground. And all that changed for him with that example was the mental model was changed. So the runners of the past have been held back by this mindset that no one could surpass the 4-minute mile. But when it was broken, the others saw immediately that they could do something that they had thought previously impossible. And I think that's the mindset that we need to take into all of our allied health professions, because that's ultimately the mindset that's going to allow us to grow, but also for our athletes to then benefit from that growth.
Absolutely.
The main focus for, Chrissy,
I just will ask one quick question in between. I'm sorry. When we speak of barriers,
sure.
Have you noticed a change in the kind of barriers you saw, say, 20 years ago within Indian sport and sports physio versus the barriers today? Because there are still barriers, I'm sure you know that. And not so much for you at your levels, but of course the levels below. But how have those barriers changed? Just quickly, if you don't mind us getting some insight.
Yeah, there's barriers for all of us at all levels of our profession. And it's one thing seeing the barrier, it's one thing for us allowing that barrier to stop us moving forward. But the greatest one that I think has been shifting is this understanding that we're all part of a holistic approach to athlete health and allowing others to have inputs into our space. And I'll talk a little bit about that later on, because I think that's important. that we have to appreciate that that others have skill sets that we don't, that ultimately is going to benefit. And previously, we never really, one, we didn't have access to those individuals, and two, we were very reluctant to let them into our space. We were too protective. So if there's one barrier that I have seen broken down, is this one of protection of our own space, which I think is a really big thing. So what it comes down to for us, as you know, is around this whole concept of injury prevention, and how do we do that? How do we go about that? In Major League Baseball, injury prevention, as they call it, was labeled as the Moneyball 2.0, because there's this belief that staying healthy is the #1 predictor of success. And the great Billy Beane, who the Moneyball movie was all about, who I've interacted with also, who's an investor in Rajasthan Royals, fortunately for us. This was his mantra. You know, if you can stay healthy, that's going to be perhaps the biggest thing we can look at in terms of predicting success and outcomes for our athletes as well as our teams. And with good reason as well, because the previous year's injury bill for just the Major League Baseball season alone was over $1 billion. So this concept of staying healthy, staying injury free is going to be a really big, mantra for all of us to hang our hats on. In a recent UEFA study, and this is fairly obvious, but it showed that the teams that have the fewer injuries in the season obviously perform better in both their domestic leagues, but also, as we all know, in the Champions League. And this can translate directly to the IPL, because if you have consistency or lack of injury means consistency of selection or team selection, which then therefore means greater consistency of performance. And at the end of the day, what does that translate to? It translates into money. And unfortunately, this world is driven by cash at the end of the day. I know that's common sense, but what this sort of means for us is that wellness is, and we use this concept of wellness more and more in sport, is this is the gateway to performance and therefore the platform for success. So always keep that in mind, that this is ultimately what we're striving for, and that's the outcome we need to be looking at. On the back of that, as I said, it's also very important to understand that sport is a very, very big business, and IPL is an incredible example of that. The revenues, it's a $10 billion league. It's now the second most valuable sporting league in the world. So the eyes of the overseas sporting world are now truly fixed on Indian sport as a result of that. And this recent announcement of the Prime Minister's intention to bid for the 2036 Olympics has also brought a renewed interest into Indian sporting geography. But are we ready for it? And we need to ponder that question, is that, are we ready? Is the infrastructure ready? The eyeballs on us now from the other leagues around the world. There's sudden interest in this, the world's second biggest league. We are becoming a focus, and we need to demonstrate within our world and the ecosystem support that we provide to athletes and teams and the general sporting population, that we're capable of doing that. And we can only do that on the back of knowledge and learning, which is what this is all about. And thankfully, that's why we're all here, and that's why I'm, really happy to be here. And so the players that are in my world of the IPL at the moment and all the franchise-based sports, they're viewed as assets, effectively, where they're bought, they're sold, they're traded on a market like commodities on any stock exchange. But because of the money that's invested, the franchises now need to see return on these assets. They've invested heavily in them, but they can only do that if they're on the field and they're performing and they're being visible. So that, for me, then poses the most obvious question, and I pose this often to people, is, so therefore, who's the most important person in the modern sport team dressing room, particularly in sports like cricket, football, AFL, and some of the other team sports as well? Previously, it was probably the coach or the manager, because they plan, they set it all out. They're the sort of the orchestrators. They're the conductors of that audience. But at the moment, I think there's a big shift, and over the last 10 or 15 years, we've definitely seen that in sport. It's in most dressing rooms now, it's the physio and it's the S&C and the associated sports science team that supports the athletes. And in most dressing rooms, it's really only the physio, because often they don't have that other support. We determine who plays, who doesn't, how durable they are, how fit they are, how injury resistant they are, how happy they are, and that's another big piece that we'll dive into, and how connected they are to the rest of the team. We're the people that probably determine all that, and they're all the determinants of success if you break them down. And so me and my team, we are effectively the risk mitigators for the investor, who's the franchise owner. And we have numerous strategies in place that we implement to mitigate that injury risk. So the coach can have all the best plans in the world, but if the player is not physically prepared enough, not strong enough, not durable enough for them to implement on that plan, then it's pretty much a waste of time. So you know, the best coach in the world suddenly become the worst coach in the world because his players just aren't fit enough or durable enough to stay. And we see this in the business world as well. And if you want to put it into business terms, we use this term in business strategy around expectation mismatches, where you know, and that's one of the biggest sort of contributors to failure is you know, the coach will have one expectation of an individual or a team based on fitness or whatever, but the ability or not fulfilled by the player means total failure across the results pages. So as sports, I think it was Nick Davies, who's a really big sports scientist, broke it down and basically said, to sum it all up, is it's our role to provide a physical platform for these players to be able to play and express themselves on a match day. And pretty much that's what it comes down to in a nutshell. And as you and I know, and we all know, the players of no use to anybody if they're sitting on the physio couch, and they've got to be out there performing. You know, the asset needs to be delivering consistently for it. So therefore, the physio and the S&C team or the sports science team collectively are those asset managers. We are the risk mitigators, and it's not just for that 6 or 8 weeks of the tournament, but actually it's all year round. We need to manage these assets, maintain the relationships, build the structure around these, you know, consistently throughout the 12 months of the year, and that's the key. Particularly this relationship build, which goes on throughout the year. It's not just the 2-month relationship and then they go away, because the stronger those relationships are, then the more you're able to get out of that athlete, and that comes from having frequent associations with them. So maintaining contact throughout the off season is critical for that to happen. And so because of this, we then have to keep growing around them. We grow around them, we grow for them, and we do this, as you know, through embracing new ideas, being open to new concepts, being flexible in our thinking, mobile in our practice, and again, being very flexible and agile in our learning. And you know, you can parallel that, I suppose, to T20 cricket. You know, adaptability, flexibility, being mobile, you know, all those things are very, very relevant to our practice and the way we learn and take those learnings forward. And so therefore we have to adapt to keep up. The way our players have to adapt to keep up, we also, physicians, have to adapt and keep up, because there's rapid changes in the modern game and they're expected to keep up with those changes. We're the people that ensure that they keep up, but we can only do that if we are learning, driving our own practices, driving our thinking, and keeping up as well, and adapting alongside them. And if we don't, the only person that suffers at the end of the day is the athlete. Okay, so that means for us, it's increased skills, increased knowledge, refining our techniques, better decision making, better clinical reasoning. And because the stakes are so much higher, particularly with these highly paid professionals in these highly paid leagues, the pressure then comes back onto us to deliver. And so one of the key components,
Just a question on that, John, sorry. So because we've got a varied audience between, say, fresh graduates or even interns and master students and practicing sports physios here, along with other sports ecosystem professionals, when you say we need to develop or we need to grow with them, how would you say are the stepping stones today in India for a physio? Say for a physio, we'll talk about the other ecosystem a bit later. For a physio, because I'm sure they'd like to know from you, what are the stepping stones for them to start off as a sports physio? Like, what kind of, like, would you say a master's degree is a must? Would you say, of course, ongoing professional development through courses or mentorships, experiences? What's the ideal pathway, would you say, in like a quick way?
I think the mentorship one is a really big one. Mentorship and experience are the two, and just take any experience you can get, paid, unpaid, whatever it may be, but exposure to any, if this is sports physio, to any sporting environment that you can. So exposure, experience, mentorship is a really key one, and I'll talk a bit about that later around who you surround yourself with. But and then on the back of that, I think if you really want to go forward, then the postgraduate experience is something that should be in your pathway ahead. But you will always do better at your postgraduate if you have that experience already in place. So experience is probably the number one thing. And the point that I was going to raise also is that you try and develop your other skills as well, because they also come to the fore critically. Particularly your soft skills. So your communication skills. Okay, the better communicators become the better sports clinicians. So use this as an opportunity to learn about your own soft skill development, your communication skills. This sort of being part of and being able to integrate within a multidisciplinary sports support team, knowing that that's the environment you want to be going into. These are the skills that you need to have. So train for those skills as well. Much the same as any athlete has to train to do things, we need to be training some of these things, because these are the differentiators for us later on. We're all going to have good hand skills, we're all going to treat and whatever, but the big differentiators when it comes to athletes, and part of the thing that I'll talk about in a bit is this: what are these relationship building tools? So I think that, these are probably the things that you need to develop most, of these soft skills that are around our hardcore clinical assessment tools and treatment tools that we have in our toolboxes.
Fabulous, thank you. Yeah.
So that's a really really important piece, this whole communication piece. And are we covering every single base? We'll only ever know that if we have a relationship with the athlete. The point I raised before is that, we're never going to know everything as physios and sports physicians, but you have to be humble enough to admit that we all have limitations, and you then need to reach out to this curated network, this mentor sort of piece, if you may have those in place, in particular in people you trust. And those relationships take a while to build, those professional relationships, but you need them in place to get the right answers. There's no shame in saying I don't know, but then say, but I do know someone who does, and I'm going to seek their counsel. Okay, and I'll tell you, if you do that and take that approach, admit your limitations, then the athlete will thank you later on. Trust me, rather than hanging on to them, saying yes, but delivering nothing, you'll forever damage that relationship with the athlete. So I think you said what's changed before around barriers, what's changed now professional. I think this is one that I'm seeing changing, is that us getting sort of better as clinicians by building these sort of preferred provider networks around us, and then being able to access them. People like physios, other physios that who may have more experience for you in other sports, orthopedics, radiologists. And I actually once did a talk which was called MSK Radiologist to Physio's Best Friend, because my musculoskeletal radiologist colleagues are probably my best physio friends. They give me the answers I want. They give me the guidance I want, and they're one of the first people that I call if I'm stuck on most things. So to build out this network, I think that's really critical. In order for you to be that asset manager that we talked about, you first have to build healthy relationships with that cohort, but particularly this building of healthy relationships with and around the athlete, as well as the team that you're with, to get the best out of them. And so how does one do this? And in the best relationship builder in my world and our world is through the athlete or the sports person knowing someone that they trust first, and that's going to be guiding them or able to guide them all year round, particularly when it's needed, which is when they're injured. And that's what their biggest fear is, when they're injured. So having access to you 12 months of the year really is probably the biggest and first of those relationship builders, especially in the world that I'm in at the moment, the IPL world. And so that comes down to demonstrating this duty of care, as we call it, sort of above and beyond the player's expectations. And we do that through all the investigations that we carry out, the blood tests, the nutrition profiling, the food choices, helping them on their mental health strategies, educating them beyond the world of cricket, which is critical as well. We play a role in all of that. We also, what we call their environment creators, which is a critical piece as well. And that ensures that even beyond the playing environment of the field or the pitch itself, we're supporting them. And that then comes down to even things like having inputs onto what hotels we choose, how their team rooms look, what the dressing room setup's like, et cetera, because they all impact on performance ultimately. And I will touch a little bit on about environments later on. The other thing, relationship builder, is this concept of, you will have heard this before, but listening, and not just hearing, but actually listening to their concerns, their requirements, and then implementing strategies to solve their problems, not the problems you think they have, but their problems. And you only know their problems if you're listening to them rather than just hearing them in the background. The other really good relationship builder is what we call being their knowledge provider. The biggest fear of an athlete is not knowing or not understanding either their injury, an illness, performance sort of fluctuations, things like that. And we know that injury is what an athlete dreads most. So we need to be their educators outside of just their sporting world as well. And then ask the question, how is what I'm now doing going to have an impact on their lives or the lives of their immediate families or the people beyond the sporting arena as well? We need to always take that into consideration because they're close to the athlete. So if we're impacting the athlete positively, but we're also impacting their immediate environment and the people that are closest to them positively, then that is a huge relationship builder. But we can really only do that if we're exposing them to the latest and best practices that we have in our respective fields, whether that be through refined management systems, a process, particularly a process-driven approach to their care, providing structure around them, using technology, addressing their overall holistic health outcomes, particularly with that eye on their long-term health outcomes. That's a particularly powerful relationship builder if you're considering their long-term health outcomes for them, not just the immediate impacts we have. And for us to always realize that the impact that we have on them now and the decisions that we're taking on their behalf regarding their health and well-being has to be done with an eye on the future. Okay, their future health is critical, and it's determined by what we're doing with them now. Okay,
and that's such a big difference from, say, 10, 15 years ago, isn't it?
It's a very big difference.
Big difference. I don't think, say, 10 years ago, they would have thought of even 5 years later what this person's going to be like.
Exactly.